care and assist in home care. I'm here today with Chester Cheetah. I'm going to be doing a little lesson on how to give insulin using an insulin pen. We're ready to give Chester his insulin today, and so we have our insulin pen, we have our alcohol swab, and we have our cap here ready for us. So basically, we just need to remove the cap from our pen. You'll notice that at the top there's a little screw-on space, and that's where the needle goes. So we take our needle, we're going to peel off the top, we're going to screw it on. Once it's screwed on, you can remove the cap because there's a secondary cap there to protect the needle. We're going to do what's called a safety test. We're going to hear it click twice. We're turning the end here until we hear it click twice. Then we're going to press to make sure we get all the air and any bubbles out. We see it drip there, so we know that the safety test worked. We're ready to give him his insulin now, but before I dial it up to the dose that the doctor's prescribed, I'm going to clean a spot on Chester Cheetah's arm. Using the alcohol swab, I'll rip it open and I'll scrub. Give it about 20 seconds, just kind of like singing your ABCs to make sure that the spot is clean. Once he's clean and he's ready to go, realizing that not everybody likes it in the back of their arm, in the fatty tissue there. Some people like it in their belly, some people like it in their thigh. The idea is just making it comfortable for them and choosing a different spot each time you do it so you don't really have one spot get sore after a while getting used all the time. So I'm going to dial up the dose. It's just click, 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 click until I get to the dose that's prescribed by the doctor. I'm going to take off the secondary cover. I'm going to tell Chester Cheetah, here we go, I'm ready. I'm just going to take it and just like a little dart motion, I'm going to poke it right into the fatty tissue on the back of his arm. I'm going to take my thumb on the end and I'm just going to hold it steady so I'm not wiggling, and I'm going to press it until it stops clicking and then hold for about 2 more seconds after that to make sure that all the medicine goes into his arm. When I'm done, I pull straight back out, and there shouldn't be anything to worry about there. We do not recap our needles. Anytime you go to recap needles, you can accidentally wiggle and bump and poke yourself. And after a needle has been poked into a patient, if it pokes you, it puts you at risk for any blood-borne illnesses. So we're going to carefully grab from the sides, unscrew that needle, and we're going to take this and just throw it into a plastic container so that it can't accidentally poke anybody else. And that plastic container can be anything from a biohazard safety needle container, or it can just be a Clorox bottle with a cap, just because we're in a patient's home. So that is our lesson today. Insulin needles come in a lot of different colors and shapes. They make them pretty and pink, and we get the nice aqua colors and different pens. But the idea is the same for all of them. There's a dial up on the end, and there's a place to screw the needle on the end. And that's as simple as it is. An insulin pen is sent to the home from the pharmacy. The idea is makes it easier for us to dose insulin, since too much insulin can be very dangerous and have somebody end up in the emergency room, and too little insulin can make somebody feel sick and have other complications. So dosing is very important with insulin. But in order to give the insulin on a daily basis, the first thing you should always do is check the blood sugar. Given they haven't eaten, it's first thing in the morning, check the blood sugar, and we know that there's no problems that we should have to worry about. It wouldn't be okay to give him any more insulin if you found that his blood sugar was below 80. Less than 80, especially if it's not normal for a patient to have low blood sugars, would cause him to go even lower and put his health at risk.